Hi, I'm Dr. Langley. I am a family medicine doctor. I own Homestead Direct Primary Care here in beautiful Colorado Springs, Colorado. And like many female physicians, I get really upset when I realize there's some area of female health that isn't really well recognized and probably should be talked about more than it is. So today we're talking about vulvar pain. So that's pain on the outside of the genitals, of those skin flaps on the outside there, because sometimes it can be something called lichen planus, which is a skin condition. Lichen, kind of like the plants that grow on rocks, that kind of lichen, because it's a kind of a scaly appearance, and it tends to be flat, which is what planus comes from. So lichen planus. I kind of think of it as psoriasis. If you've ever seen psoriasis, you get kind of and it's slightly more bumpy than with lichen planus, but that tends to be on regular skin. Psoriasis does. You get kind of a flat, scaly, irritated area of skin. This, though, isn't on the regular dry skin as much as on mucous membrane. So you can get lichen planus in your mouth or genitals or other places, even in your esophagus on the inside. So lichen planus, though, causes a lot of symptoms, and I feel like it's really common in women, and they're not bringing it up, and that's what makes me want to talk to you about it today. So it's classically in 50 to 60-year-old women, but I've definitely seen it in much younger women, and older women too. They come in saying that they have burning, itching, pain, soreness, painful sex, sometimes bleeding after mild trauma or bleeding after sex that's not coming from vaginally but from the skin on the outside. And those are all not okay things. But some women just are worried that it's a sign of something they should be ashamed of, or all sorts of reasons. They just don't have a doctor they can trust with personal things like that. And that's not okay with me. So hopefully having this conversation on YouTube will allow you to be more comfortable with your doctor to talk about it. So a little bit more details. Sometimes these rashes come up and they cause symptoms once in a while. Sometimes they're all the time. And the really big thing that worries me is that those ulcerations, that damage to the skin there, can cause scarring. And that scarring can be irreversible. I mean, you can do things to change the scarring, but they're pretty invasive things like steroid injections or surgery. Not things that I really appreciate having done down there. And so that's what we're trying to avoid. And that scarring, scarring classically contracts and so brings tissue together. So that can get in the way of urination, painful urination, or even unable to urinate because the skin is closed over the outside of the urethra. Not okay. Or even painful sex, or unable to have sex, or having to use dilators in order to get to the point where you can have sex in the future. So I would much prefer women to get this treated earlier and not have to use dilators and steroid treatments and scar surgery. Those are just not okay with me. So how does it look? I mean, sometimes it's tricky to look down there, but if you can get a mirror or get a trusted partner, it looks red. It might have little white lines across it, and it bleeds easily, and it's really tender. It doesn't look right. I mean, it's tough because things are red down there, but this is a different kind of like beefier red. Sometimes women will know that it's lichen planus for sure because they have similar lesions in their mouth, and they're more willing to talk about that because it is an autoimmune disease. It's your own body attacking itself for a reason we don't really understand, and so it can happen in more than one place, or sometimes it can just be in one place. Sometimes it can be diagnosed by a doctor just by looking at it. Sometimes it does require a biopsy, especially because sometimes cancers can look like that kind of raw, irritated area of skin, and that will help us be sure that it's not a cancer, that it is just lichen planus to do a biopsy. But also, cancer won't get better with topical steroids, so it's also reasonable to try around with topical steroids because that's the mainstay of treatment. Just like a lot of skin conditions, eczema, psoriasis, it's all about topical steroids. Now, usually, like eczema, psoriasis, we're trying to avoid using too much or too strong of steroids because it can cause thinning of the skin or a lightening of the color of the skin. This area just happens to be more proliferative in how it grows, and we're not so worried about the color. So we load those steroids on. We use maximum dose of strongest steroids to get rid of it as soon as possible because we're really trying to avoid that scarring. So clobetasol ointment tends to be the mainstay. That's a super potent steroid is what it's called. You wouldn't want to use it regularly on your regular skin, but using it for lichen planus is considered the way to go. You usually apply it every night, especially when you're having a flare. You kind of put it on half of your fingertip. That's how much usually is needed to cover the vulvar area that is potentially going to have trouble with lichen planus. And you do that every night until it's feeling a lot better, and then you can go every other night, partially to decrease how much steroid you use, partially just because it's a hassle to remember to put it on there, so spacing it out can be nice. If this isn't taking care of it, there are other options, like tacrolimus is another external cream, or even steroids that are injected or that you take orally if it's that bad. But there's also things you can do in your life that can help decrease the symptoms that you're having from the lichen planus. And they're kind of the same kinds of things that you're doing just for general vulvar and vaginal health. So I'm going to link to that video there so that you can see my video on how you can better take care of yourself down there. I hope that was helpful. I hope that if you're having these symptoms, you have the confidence now to talk to your doctor. And if you wouldn't mind subscribing to my channel so that you get notified when I post new videos. Thanks for watching.